We have 2 patients in this practice in the last 10 years who I know specifically presented at Chester County with a subdural hematoma. Emergency care wasn't available. They had to be transported to Philadelphia, and I know that both of these patients died.
I never thought I'd live long enough to see healthcare for women and children get to this point. I just never thought I would live to see this.
I personally have been sued for patients that I've never cared for. I've been accused of ordering medicines that I have never ordered. The medical malpractice insurance for my group rose 25 times, not 25%, 25 times. Imagine if your car insurance went up 25 times, would you still be able to drive?
For residents in Pennsylvania, this isn't just a road, it's a waiting room. Out-of-control tort lawsuits have forced doctors in high-risk specialties like neurosurgery and obstetrics to leave. So patients here don't ask how much or how fast, they ask how far.
They've closed 18 OBGYN facilities in the Philadelphia area. Now, just imagine if your wife was having a child, there's 18 less facilities to go to.
The last hospital that was left in Northeast Philadelphia as of 3 years ago was Jean's Hospital. They closed in May of 2007.
My name's Melissa Green. I'm from Warminster, Pennsylvania. I'm married to Bill Green for about 4 years. It was a month after we got married, I found out that we were going to have a little boy. And the only place that was left open around us, well, the closest hospital was Jean's.
Jean's announced they were cutting off new patients like June, and Billy was being born in mid-April. We were told we made the cut, but there was obviously people when we went that were after us, and they were told they had to go find another hospital.
Everything was going great, and then one night I woke up and I just started bleeding, and I couldn't stop.
The Greens' terrible situation is the result of lawyers using Pennsylvania's courts like a casino. The state has no cap on pain and suffering awards, so plaintiffs win millions with even frivolous claims. But after countless jackpots, they find themselves with no one left to sue. That's what was happening in Texas in the 90s, when doctors were leaving the state, or at least moving to wealthier urban areas, turning rural areas like Corpus Christi into healthcare ghost towns. But in 2003, they reformed their tort system.
As a direct consequence of what we did, lawsuits against doctors have been cut by more than half. We went from 35,000 practicing physicians to today we have 55,000 in just 6.5 years later.
You're happy?
Very happy.
I would not have come down to Texas without that protection. My first night in Corpus Christi, I got a call around 11 o'clock at night, and it was a patient who suddenly couldn't move his legs. If there's no neurosurgeon on call, this patient would have been paralyzed for the rest of his life. He's now actually able to walk. He'll come to my waiting room and he told other patients that, Dr. Alexander made me walk. I couldn't walk.
So what if Pennsylvania, with its million-dollar lawsuits and closing maternity wards, chooses not to reform as Texas did?
You're going to see more deaths of moms and babies. You're going to see more complications potentially, more moms having hysterectomies. Philadelphia is not a safe place to have a baby anymore.
One night I woke up and I just started bleeding and I couldn't stop.
We got there at 8 o'clock and Billy was born at 8:12. We basically had 12, we got in there at 12 minutes, we had the baby.
Billy was born April of '07, and he's like a wonderful little boy. He just loves to play and jump and do everything that little boys do. And I thank God that Jean's was open at the time, because if Jean's wasn't there, we would have had to go to a further hospital, and that wouldn't...
Melissa almost didn't make it with the amount of blood she was losing. If Jean's wasn't there, we wouldn't have been able to get to another hospital. And I might not have either one of them today. They said 5 minutes. They said that's all you really had, give or take. And you'd hate to see a mortality, infant mortality increase because there's just not enough maternity wards.